Hello everyone. 21st September annually is observed as World Alzheimer's Day. This year, the theme is Time to Act on Dementia, Time to Act on Alzheimer's. It's important for us to understand that Alzheimer's disease, dementia, is becoming a global pandemic and we need to act fast. We need to raise that kind of awareness, that kind of sensitivity that people are able to recognize it, catch it on earlier, this disease, catch it earlier and begin treatment, begin interventions early on. Globally, if we see in 2017, 50 million people were affected by this disease. This number is set to go up to 75 million by 2030 and by 130 million by 2050. So we are seeing that there's an exponential increase in the number of people that are suffering from this disease. In India, presently, we have around 5 million people who have this disease. Every year, 9.9, almost 10 million people are added to the numbers. So it is an alarming issue. Whether it was there, it was always there, but today we are able to pick on the signs, we're able to catch on it earlier, and we can start the interventions which can prevent the disabilities from coming in at an earlier stage. We can improve the quality of life. We are from Cooj Mental Health Foundation, which is an NGO working for the promotion of mental health in Goa. We run a dementia care program. I am Dr. Peter Castellino. I'm the director of Cooj. Along with me in the studio is Dale Fonseca, who is the coordinator of the Geriatric and Dementia Care Program. And we have Donna Norona, who, though is in the suicide prevention program, today is here as a caregiver of someone, of a parent who has dementia. So to kick on this discussion, I'd like to ask Donna to give us a little brief, a little bit background about your life as a caregiver, how it is looking after your parent who has dementia.
Thank you, Doctor, for raising awareness on Alzheimer's today, and it's so important. As a caregiver for a parent, it's really very difficult. And for me, it all started out many years back when we weren't aware about the signs and symptoms. For me, and I'm sure this would resonate with a lot of people here who have challenging parents to deal with, right through, it's very difficult to identify that there is something really wrong till something stands out. And for me, I realized that at some point before the pandemic, there was this constant repetition that my mother would constantly be repeating herself. She would keep things, and we would be constantly searching for things that were lost. So many times you pass it off as just the normal, just the aging process. But I think it got to a point where things started getting very difficult, because her personality is that of a very strong one. She's very aggressive if she has to be. So there was this aggression that was unaccountable for. We could not understand why there was suddenly so much of aggression, and it was getting difficult till a point where I realized that I needed to take her to the doctor to understand what was really wrong, whether there was depression. I mean, since we have been working in the area of mental health for so long, sometimes we do identify certain behaviors, and I think getting her initially was a wise thing to do. And I remember the doctor telling me that this is an early onset of Alzheimer's. And
so what you're trying to say is that the repetition, she constantly was kind of repeating herself, saying the same thing again and again, and you saw the level, there's an increase in the level of her aggression, and she was misplacing things. So initially you were not really sure whether this was a part of a normal aging process or whether there was something to be concerned about. Yeah. But you still took her to a doctor, which was very good. So the change in behavior, just the upping of the symptoms was a red flag for you, which...
And I would really like to understand, what is the difference between dementia and Alzheimer's?
See, dementia is kind of the umbrella term. Yeah, it is. First of all, what is dementia? So dementia is it's a neurological condition which is progressive in nature. Yeah, so it is a decline in the neuronal the neurons of the brain. The brain chemistry changes, and this is progressively it deteriorates. Yeah? What happens to the person is when the person loses his memory, it can lose his other cognitive functions like his language skills, his ability to catch words, his ability to use the right words in conversations, or he may use wrong language. He may get disoriented in terms of he may be at home but not really know that he's at home. He still thinks he's somewhere else, or he may lose touch with familiar surroundings. So he goes to a market which he's regularly going to the market, but once he goes to the market he's totally lost. I don't know where I am. Yeah, so his executive functions can get affected, his language can get affected. It's not only a condition of the memory, and that's where most people get a little bit lost in the sense that they say these issues are just a normal aging process, but it's not a normal aging process because it's just not the memory, but it's a lot of the other functions of the brain that are also getting affected. So dementia is the umbrella term. Alzheimer's is one type of dementia. Yeah, so almost 60 to 80% cases of dementia we see are of the Alzheimer's type. But we have a lot of other types of dementias also. We have a dementia of the vascular dementia. So a lot of people who have vascular conditions like hypertension, or they have got ischemic heart disease, they are more prone to a vascular kind of dementia. Then you have a dementia which sets in first with personality changes. The person becomes more impulsive, you'll find behavioral changes, you'll find inhibitory behaviors, and then okay, it's something more to do with the frontal part of the brain. So you have a frontotemporal kind of dementia. Or you have dementias which are associated with Parkinson's disease. Yeah, the Parkinson's type of dementia. So you've got the alcohol-induced dementia, you've got dementia due to HIV, due to various viruses, or due to certain toxins. Yeah, so you've got different types of dementias, and the thing is why it's important to seek help early, because some of the dementias are reversible. Like an alcohol-induced dementia, if you give him the right kind of vitamins, and he can improve, he can come back. Yeah, so a lot of them, not all, a lot of them, but some of them are reversible. A large number are non-reversible, and they're progressive. So with time, the disease process kind of worsens with time. So, and that's why people get confused. What is this Alzheimer's? What is this dementia? Yeah, Alzheimer's is a type of dementia, and but a good question is, how do you differentiate that normal aging from the aging sorry, not the normal, the memory loss of a normal aging and memory loss of someone with dementia? Yeah, so this is where I think probably you all also were confused.
Yeah, we were. So what I guess is that I had a grandfather who died at 99, and he had perfect memory. He was a musician, and he was a very connected to prayer, and so he with him, although there were names and things he forget, the basic memories of certain things is what he always remembered. But I don't see this happening with my mother, and even with my grandmother, my mother's mother. So my mother's mother also, at some point, she a lot of things changed. She would like to she was a very social person, but then later on things changed, and then my uncle was looking after, and it was very difficult to look after her, because constantly there was this repetition and not saying, and not being able to get things, and then we began to see that things became worse. However, with my mother, we are at a point where I'm beginning to see it going downhill, because I feel her short-term memory is very compromised.
Yes.
And it's like you just say something and the next minute it's forgotten, and sometimes because of the kind of person that she is, with her personality, where she had control of a lot of things, not willing to let go of that control, trust issues coming in. And I'm sure a lot of people will feel that initially they'll just want to abandon their parent, and they'll just want to say, this is okay, they want it that way, let them have it that way. But it's somewhere the reasoning, you know, is of the person seems to be very challenged, and it is very very hard when you have to live with a parent which has got such a level of you know, control, and then also realizing that there are so many other things that are also needed. So
Yeah.
that becomes very difficult.
Yeah. So that thing of that what you said, no, that short-term memory, you know, and that's why, because they've forgotten that they've asked you a particular question, they've totally forgot about it. So they'll ask it again as if they're asking it new, and that is what kind of separates dementia from normal from memory loss or normal aging. You know, repetition does happen, but not as frequent. And here, what happens? They will forget entire chunks of information. Like suppose they've gone for a party yesterday, they've totally forgotten that they've gone for a party. Yeah, or they've just had their meal and they said, "But you never gave me anything to eat." And they said, "But mom, I just gave you something to eat, and didn't you have the lovely sandwiches? I mean, you know, I gave you all these snacks and all. You gave me nothing." So, you know, immediately they have forgotten full chunks of information. Whereas in normal aging, you will not forget so much. You know, you'll say, yes, I had a meal, but I don't remember exactly what was there on the plate. Yeah. So people with dementia, they'll forget that they've taken their medicines. Or they'll say that I've taken my medicines, and actually they've not. I've taken my medicines, but why should I take it again? I've not gone for, or I've gone for my bath, why should I go for a bath again? You know, so they get into these kind of
How does
behaviors.
that work? I mean, because yes, as you're rightly saying, you know, you do see a person, as you said, initially I don't remember what I've eaten, but then it comes to a point where you've not given me to eat. So what is that time phase? I mean, how does this progress? I mean, what is...
How? So exactly. So again, dementia goes through stages. You know, first you'll have the early stage, the mid stage, and then the late stage. Now this can take sometimes from early to late, can take 10 years, you know, 8, 10, 12 years. It can go on for a long period of time. But in some people, it can be a rapid decline. Hardly you diagnose it, in months the decline takes place. Yeah. So, and therefore, what we can do is to help a person is just delay that progression as much as possible. You know, yeah, catch it early, delay it. You know, so that's what as doctors we can do, and kind of support the caregivers, because as Donna is saying, as a caregiver, it is so very difficult to deal with it. And maybe I mean, Dale can share us a little bit more on like, you know, how Donna as a caregiver can really just support her mother, because I think caregiver support is very very important in the treatment.
Yeah, absolutely, because you need two hands to clap. It's not just you know, medication. It's not just you know, the doctor's part. There's also the caregiver who has, and it's not even just about the patient here. It's a matter of the full thing is involved. I mean, everybody is involved. It takes a whole village to look after somebody with dementia, and definitely the caregiver really is playing up with so many roles. Like as a caregiver, you definitely have this whole role reversal of being the parent to a parent, and that's really hard for specifically a parent like yours who is in control and loves being in control. And definitely it requires a lot of patience and a lot of compassion, a lot of empathy. Besides the fact that now you are the parent, now you also have other responsibilities. You're not just a caregiver anymore, you know, you are technically, you have a job. You know, nowadays kids are working, and there are mostly, since dementia affects the elderly, it is basically there are adult kids, and they are either working or having their own families, you know. So they have to support both. They have to support your parent, and then you have to support you know, your loved one as well. Yeah. And it's a lot, and just not that, you have to also care for the patients, for your parents, you know, needs. This could be their nutritional care, ensuring that they're eating their food on time, that they're taking their meds on time, and ensuring that they're safe, because safety is also compromised.
So just maintaining that balance.
Maintaining the entire balance, you know, you're maintaining the balance between your own personal life and the life of the person with dementia. And it's the least appreciative job, you see. It's an expected thing, you know, it's an expected thing that, oh, the caregiver, I'm ill, you have to look after me, or the world also perceives caregivers in that manner. They don't understand the millions of roles you are playing and the balance that you're trying to establish.
I think now it's more difficult because we live in nuclear families.
Absolutely.
You know, before when we were living in joint families, there were a lot more people to kind of support,
Yes.
and you could easily go to work and someone was
Yes.
there. But now the biggest challenge really is getting someone. If you have to go to work, who's going to look after your parent
And someone you can trust.
someone you can trust,
And someone your loved one trusts.
And it's a very big cost factor because you have to, get a maid. And today I know because there are so many people who call me and ask me, but is there a live-in maid? I need someone to look after aging parent, and they need to be. So it's a big cost as well,
so it's
because
a treatment cost, the caregiver cost, and most caregivers do not do your other housework, so then you have to have a maid cost. So it's the costs just keep mounting.
Yes.
And what you said is again getting someone that you can trust.
Yes,
Yes.
absolutely. And also what your parent trusts, and the person your parent also
Yes.
trusts, because in dementia, a lot of these things are affected. The idea of trust is also affected because of as severe as they get, they are not going to be able to trust you.
And
that
confusion,
easily. And the
because of the confusion
Yes.
that comes in. No?
Yes.
Sometimes, like as the memory declines, they will, like right now, at least your mom knows who you are, but
Yes,
with time she
yes.
may not even know who you are.
Yeah, and to prepare yourself for that needs a lot of emotional space and help. And as you rightly said, you need a village to raise a person who has, to look after someone who has dementia. And also for the caregiver, it's so important that you have some kind of an emotional support, because you're doing, you are answering questions day in and day out, and the same questions every 5
Exhausting.
minutes. It is very, very exhausting. And then sometimes you will see that suddenly they choose when they want to do things or they don't want to do things. And so, I really appreciate the fact that, I have Cooj and the senior therapy center there, where I can come back to you all and ask you all, how do I think out of the box?
Right.
What do I need to do? And there are many times when, there have been certain things that have helped me to also look at it in a different way. And I think sometimes that understanding and patience is very, very important. Because if we keep conflicting with them, it's just a burnout.
Absolutely.
And it's very stressful. So sometimes
so what
I think,
helped you is also just talking to someone who knows
Yes.
a little and is more objective.
yes,
you know?
yes,
Maybe
because
you would
here there's so
know,
much
but-
of connect. Because when you have a challenging relationship for a long time with a parent, and when you reach a point now where you are becoming a parent to a parent, you are also confused because you've never learned this, you never know this, and it's just like now, how do you take it? What do you do? Like you keep seeing mistake. So for me, it's like my mom keeps bringing animals in now. She loves to keep bringing them, and then it's not easy then to let those animals go. So how do you do? How do you stall them? How do you get their mind off a certain thing, or
So actually, what you have actually you've kind of clubbed a lot of things that a lot of strategies that we already do. And honestly speaking, caregivers as yourself actually come up with so many techniques all by yourself. And the crux of it all is basically being empathetic, being objective. Also, one thing is stepping out of the box of the fact that, okay, I know my parent, this is how it is, but let me look at this illness from my parents' eyes, and how they look at the situation, and probably how the illness kind of also pulls through. And as you rightfully said, there are lucid moments where you just wonder, like, is she pretending, or is she really sick?
Really, are they really?
And
Yeah,
and it is very common in Alzheimer's type, because absolutely these lucid moments really confuse you. And again, there are various strategies before intervening into a particular situation. But what you need to understand is that you need to understand that, do I really need to intervene in certain things, or do I not have to
it's
intervene?
like choose your battles.
Choose your battles,
Yeah.
choose the situation. Like so when you're doing something like that, always consider the fact that, okay, is my parent safe at this point? I know this behavior is annoying me and irritating me, but is it making my parent happy? Is it not affecting me in any way? And it's not affecting him and keeping him safe. So that's the one thing you need to consider before deciding that you need to intervene in this situation. Like, say for example, your parent is just removing all their clothes out folding them back, putting them back inside, removing it again because he's forgotten he's done this the first time. So again, as annoying as it seems, it is keeping your parent busy, and sometimes you have to leave things be and be like, okay, you know, let this be as it is. Another thing is to look for, as you said, how do I know what to do? Because you need to also look for triggers, why this person is behaving the way they're behaving. You know, there could be different triggers, you know, just as our behavior is triggered by something. Sometimes when we're too hungry, we are more angrier. So it's pretty similar in that sense, because people with dementia may be feeling hungry but unable to talk about it, unable to express it, because their brain does not allow them to, you know, do that for them. So
Or what I have seen in my since I bring my mother actively to the center,
Yes.
I think that 9:30 to 12:30 is when she's engaged.
A structure.
So you know, so there is a structure there. She's asked to do things. So, and they're light things which are very manageable,
Yes.
which they can do. Plus, there is a community of other seniors. Same. So
Absolutely.
everybody has the illness, and everyone doesn't remember what the other said, and so they keep repeating their stories. There's a level of acceptance there. And so I see that really keeping that engagement,
Yes.
you know, that really works
Yes.
very, very well. Because when they are kept there and they become despondent, that's when the triggers start, like, you know, what to do.
Like, imagine if you had nobody to talk to and nobody understood
Studio, yes.
It is
Yes.
precisely that.
Yeah.
I mean, obviously at Cooj, it is a community where we are open to accepting you for who you are, and that is one of our aims, is to improving the quality of life of our seniors. And we like, you know, obviously the strategy of the repetitive questions and, you know, repeating the same story over and over again is just patiently, you know, listening to the person like it's the first time, although it's probably the 10th time for us. But, you know, we listen to the story over and over again. And what's interesting is, even if you hear it for the 10th time, there's a new interesting, you know,
Twist.
fact and twist to the
Twist to it,
story.
yeah.
And that's how interesting people are. They cannot.
And
Even-
very interesting what you said also is, to help you to deal with that are two things. You use two very nice words, is to be empathetic. And when you're empathetic, you're actually able to be objective better. But to be empathetic in such a situation, it is like you have to really step back and see life from their shoes. And their shoes is like, they've said it for the 10th time, but they've forgotten, and now they're asking, why are you making such a big deal about it? Like, you know, I'm telling you for the first time. So it's like when they get out and they don't know where to go, it's like they're literally confused. They're literally confused and they're lost. And that's what makes them feel, you know, they need someone at that time to really empathize with what they're going through at that point in time. And they look out to us. But if we kind of react to that, that will actually increase their aggression, increase their irritability, increase a lot of behavioral symptoms. And if you see, in managing symptoms, behavioral management is one of the key strategies to dealing with someone with dementia. The medicine has some role. Medicine has some role. And that too, medicine helps probably in the early stages, a little bit in the mid stages. But more than medicine is behavioral management. And for you all, for caregivers to first understand that, and to be empathetic is not easy. So you need to constantly be talking, you know, like as you said, at least you have people to talk to share. So that helps you
But
at least
in
to
that moment of the illness, they will say something to you that leaves you so you know, so lost. And like, why do I have to take these medicines when, you know, it's not making any improvement?
Yeah.
And then, you know, but thank God for the short-term memory, they don't
They
remember.
have
So you
forgotten
come,
it.
they've
So you
forgotten
can use
it.
that as a strategy.
So
So
you can
yeah.
use that as
Yeah,
a
yeah,
strategy sometimes.
So
yeah.
that's why they talk about distraction, you know.
Yeah.
It's the most simplest, the most easiest. You distract rather than, you know, rather than reacting.
Yeah.
You know,
Yeah.
even giving them that space, you know, as you said, specifically when it's someone who's mostly aggressive and loves to be in control. And, you know, giving them that space, you know, giving them that, you know, you can easily just, you know, leave the room, and, like, you know, that also kind of gives the person some time to actually recoup and they'll forget. So that's
So
another thing.
one question that I really want to ask, especially with the parent who has a lot of control over their finances, because see, they have been very responsible adults right through their years, and they have always been the provider for the family. They've taken hold of the financial aspect of the the entire setting, and now they come to a point where I want my money in my old age, and why are you not giving me this money? And so doctor, what do you do? Because I'm sure there may be many people like me out there who've got parents who are going to the banks and just taking out money, or what is the kind of a what do we need to do in such a situation?
So the new Mental Health Care Act of 2017 is very clear about this, because after a certain point, the person is not able to make the right decision. Decision making capacity gets affected as part of the dementia, so they're not able to make the right kind of decisions. Their judgment gets impaired, as you said, the memory gets impaired, so they're not, they're mismanaging their assets, and therefore the law allows us then to appoint a guardian. So where now no more that person takes control, the guardian takes control. Now this is it's easy on paper, easy theoretically, but in a lot of people with dementia, they have that control thing. You're letting go, they can't let go of control. And there's no real easy answer to this.
No, because
how?
I know.
But the law gives you the opportunity to appoint a guardian, and then the guardian looks after and manages the affairs of that person, and
What
assets.
a lot of people also share with me is that sometimes you have these financial people from the banks who don't know that there is the person has this illness, and they'll sell them policies, and in that way sometimes many seniors get cheated into
so
taking investments.
Once the guardianship takes over, then they cannot do that, because their signature is no more valid. Their signature is no more valid, so they cannot. So there are those protective points in place, which you can really take advantage of, and I think people should take advantage of it, because there will be a drain in the assets, because it will not be used wisely. They'll and people can manipulate them. Because they can't remember, their decision making capacity is wrong. They can be manipulated.
And exactly.
So it is better to approach a lot of maybe a lawyer, find out how you can protect yourself. There's a mental health review board, where you can we can deem your person unfit to make decisions, or go to your psychiatrist, go to a mental health professional who will give you the fitness, the unfits certificate, and for that they can actually get the guardianship done. So that is one aspect, and really, if you go to see, it is not their fault. We have to constantly tell us that it's not their fault, even though they are in full command of the situation at that time. They do not really know what they're doing. It's not their fault, because their brain is playing tricks with them right now. The brain is really not working the way it used to be. As I said, there's like for instance, for every part, every function of the brain, it requires that much of neurons. Neurons are the nerve cells. But now there's a deterioration in the number. There's a decrease in the number of those neurons, because the neurons are getting damaged. And they get damaged because either there are some protein deposits that take place within the neurons or outside the neurons, and there is a damage that is taking place. So there is a neuronal loss, and so there isn't enough of neurons to execute those functions. So what we see is, imagine a tree in full bloom. In spring, it's in full bloom, and then you look at it as a deciduous tree in winter, when the leaves all start falling apart. This is what happens with dementia. The amount of those leaves, those connections, those branches all begin to reduce. And now with that limited capacity of the brain, they are functioning. So it is not easy. They don't have that much brain matter. Physically, they don't have that much brain matter, and therefore the brain is not able to execute its functions. So when I think one of the reasons I think we are here is to educate people. So when people really are aware that it's not their fault, and because this is what happens in the brain, and that you have to use empathy, you have to use objectivity, and there are no medicines which are quick fix. Most people want a quick fix answer. But as you were saying, there are so many behavioral changes, and it is our approach to those behaviors is one of the mainstays of treatment. Yeah.
One is that aspect, and see, also when we are looking at behavioral management, there's no one-stop solution. You know, there is a mix of different strategies at different situations. You know, today it may work, tomorrow it may not work. And another thing, what caregivers also miss out is in the fact of taking care of themselves. You know, we're very focused on the patient, and we forget about, even a doctor would always be like, the medications, and this is how you care for your loved one, this is what you have to do. But what about the caregiver? The caregiver is so exhausted with the millions of things they have to do that it is affecting caregiving. It is affecting the way they interact. They are angry a lot more. They're experiencing a lot. There are more arguments because they're tired, because they're exhausted, because they have to, keep, like, even let's say as the illness gets severe and the person's activities of daily living start getting affected, and specifically, specifically your personal grooming. They are like, I don't want to have a bath today, because
I want to have a bath 3 times a day.
Or 3 times a day, yeah. So the thing is, it's difficult for a caregiver to manage this because he has to worry about the fact that you have to have a bath, and then I have to, figure out dinner. I have to figure out other things. There are other roles that I'm playing here. So he gets irritated, like, come on now, why are you wasting my time? You reach that point. Like, it's very easy for us from this platform of being a professional to be like, oh, you have to try your best to be sweet, and it's okay. It's okay to, feel that way. And then there's this whole idea of guilt also. Then the caregiver feels guilty. Okay, I'm not doing enough for my loved one. There's a lot more. I wish I could do a lot more. And the whole point is focusing on you too, finding resources. What's important is, like I said earlier, is finding a village to help you, be it even a neighbor. Like, say, for example, you have to be somewhere, and that your parent is okay with this particular neighbor, just be like, can you just wait with this person while I go? Then also finding ways to, keep time for yourself. So mostly caregivers are very isolated because of this issue. Caregivers don't have anybody to talk to because they feel, why should I, wash dirty linen in public? So, and but it would really help, like, if caregivers could connect with each other and, speak to each other about the issues that they have, share notes.
One issue, this is very interesting what you said, is build your resources, And one thing which I've observed with a lot of people who come to me, it's like you'll find they've got large families, but there's only one sibling, means one child that is actually looking after the parent. The others are all there. And very often now, being in Goa, a lot of the children are living abroad. There's one child looking here, and they take on the entire burden. The others are all there. They'll phone up, they'll send money. But what this person requires is a break. So I think sometimes it is important to tell your other family members, listen, I can't do it. I cannot do, I know you're abroad, but I think it's your parent also, and please, everyone has to share this responsibility. It cannot be my responsibility alone, because I am draining. And as you said very clearly, I'm getting more irritable. That irritability is brushing onto my parent. They are getting irritable, and now there is no fix for this, and medicines are not going to fix this. It is, as you said, burnout. People are burnt out, and I know of people who love their parent to bits, but sometimes internally they just wish that they were dead. And then as soon as they think it, they feel so guilty for thinking that. How could I even think of that? But they are into that. It's basically burnout, It's basically burnout. So it's important to build that support system around you. And I think do it as early as you kind of detect the dementia, so that later on, as the person progresses, the dementia progresses, the person is familiar with more people, familiar with more people. Yeah. So what is like, if I ask you, like you mentioned a few challenging situations, what is the one that strikes you the most, like when you look at your mom, like,
So,
maybe I'll put this, which is your biggest fear, which is your biggest fear that you would have with your mom?
I think one fear is when she goes to the market frequently without being, and everybody will reprimand, how can you let her, how can you let her go? And But I just don't have control of that, and I just pray to Almighty God that send guardian angels and be with her, because I can't do anything. But what I have done to the best I can is that people within the markets who know me and her, like I kind of tell them, if she comes here, if she gets lost or anything, like I have one of my neighbor is a police officer. I've got people in the market who know her well. In fact, once when we had taken mom to the doctor, and the doctor said, well, what would happen if you just lost your memory in the market? And she said, I've been doing this for 30 years. They will bring me home because all the pilots know where I live. So that got me thinking again. And
Yeah.
so sometimes I think you need to do certain things to calm your fears, and that's the best you can do. And the rest is surrender. Beyond that, there's
Yeah.
nothing
but the
else could you
strategy
do.
is good, but the strategy is good. You've already, which area she normally goes to, and you've already kind of involved that community.
Yeah, I
and
kind of
you've
have their numbers, and it's like, please, in case she's here
Yeah.
and she's lost, because there are a lot of times when my mom has lost her bags in the market, and we had to search for them, and so that's the time even the people around began to realize that there was something wrong. This is not the same person, because rightly they knew her for 30 years.
Yeah.
She would come there shopping every day. But what happens is, the fear is that she does it alone, and you can't jail her, you can't, you can't do that to a parent,
Yeah.
because they believe nothing is wrong. So even if they're post 70 and they're active and they're functional,
Yeah.
this is a fear, but somehow you just say,
Yeah. But in a way,
all to
also
Jesus
by,
I surrender.
in a way, also by going and telling all these people, you've kind of educated them on dementia.
Yeah.
You've educated them there is something
Yes.
like this. People
Yeah.
can get lost. They're not deliberately doing it. So
Yeah.
please take care of my mom. You've told like everyone,
Yeah, like-
please be there.
Yeah, not everyone, but
It's whoever-
the basic people connected,
people
like
connect, yeah.
the grocery person, the meat person,
Yeah.
the pharmacy, because every time she goes there for medication, so
Yeah.
like that.
Yeah. Yeah.
So yeah, that's the fear I would say that I kind of work with and think out of the box to deal with,
Yeah.
because
It's a constant, no?
it's a
It's a
constant. Yeah,
constant
it's like a
thing
flow.
out of
It's
the
like
box.
a yeah.
And there are no clear-cut answers. No one can ever give that to you. You have
Absolutely not.
But one
Yeah.
question that I really want to ask you is, now that I saw my grandmother having this and then I saw my mom going through it, what is the odds of me getting it?
I asked that same question to myself, because I also have family
And-
members. You
and
all-
me too.
In fact, all three of us have family members.
I'm not saying,
with
the
dementia, and that's a question I think I've been asking myself constantly. And luckily, recently, I think in 2020, they came out with a lot of risk factors which can lead to dementia. And almost 60% of those risk factors are non-modifiable, like our genetics loading, whatever we get from there, we cannot change that. Our age, we cannot change that. There are certain things which are our gender, we cannot. But there are 40% of modifiable changes. Basically, they're lifelong health modifiable changes. In the sense, if you eat healthy, if you exercise regularly, if you basically take care of yourself, you challenge your brain, you learn new things, you deal with obesity, with hypertension, with don't smoke, drinking. They say only 21 units per week is okay. But some studies say even 5-10 units is not okay. So there are studies on alcohol, but with smoking they say it can reduce your risk by almost 23%. So there are these modifiable factors, and if we can, and basically most of, as I said, they are lifestyle changes, and if we can just be a little bit more healthier in our diets, in our exercise, I think we can kind of push dementia.
Also
a little
being
bit more away.
social,
Being social, yes.
So that's
yes.
something that I realize is, like, as you grow older, we lose a lot of people along the way, be it your family members, and you're so as younger adults, we're so caught up with our own lives that we kind of lose out on friends. And it's so important to have the right kind of friends, and take them through your old age too, because that's the time you're going to have a lot more time, and you're going to have a lot more you want to less people to interact with.
Yeah.
So it's very important to stay social, to stay connected, because all those require, like, all those communication skills actually like you learn new things together, so that also contributes
Yeah.
in improving your brain health and
Yeah.
also improving reducing your risk towards
and this has been
dementia.
researched and studied,
Yes.
you know, that people who are more isolated and more alone have a higher risk of getting dementia than those who are more social and more connected. And you know, because that, as you said, improves the neurotransmitters in the brain, the connections within the brain, and neuronal load. So it actually we have something called neuroplasticity, what we call, where we can like for instance, if say your liver a little bit is cut, I mean the liver can grow a little bit, you know, that can grow. So similarly, the brain, the neurons can actually start having newer connections, and every time it is stimulated, every time it's challenged, you know, you can develop this. So it is important to live a very active, social, healthy life. Yeah. And this is, see, again, this question comes that, you know, dementia is not part of old age. That is one thing we have to remember, because we have people even below the age of 60 who can get dementia. We've got people as early as in the late 30s and early 40s, though it's much more rare. Most often we see it post 60, 65 where people get dementia, but yes, it can come in as early as late 30s. But we also see on the other side, which is a very good thing, is that you'll have seniors in their 90s, you know, touching 100, who have fantastic memories, you know,
Yeah.
who are so active socially. I mean, like my neighbors. I mean, I have two neighbors who are in their 90s and living alone, living a full life, active social life. They'll do their own cooking. They'll, you know, they love to watch Netflix and to be in touch with the latest what's going on.
But I think
and
that also is very, because in my case, my mother has a smartphone, so she's always there and she's listening. So you know that slowing down the process.
Yes.
These come in as aids,
Come in as
and you know
aids,
this
yes.
really
Come in as
works
aids,
well.
definitely.
And also in a way is like, you know, even music, like different kinds of things like Netflix, you know,
yes.
old shows that help them remember the good old days. Like, you know,
Yes.
I think a hit in my workplace is definitely Mind Your Language. And
I Love Lucy.
I Love Lucy. And you know, these shows actually bring them happiness is one thing, brings them like the best memories from these music videos like Elvis and
Yeah.
you know, these old Paul Anka and these old singers and you know, your old Konkani movies bring
Yes.
back, you know, it's reminiscing.
It's
You know,
reminiscing.
it's not about them remembering certain facts and details. It's about remembering what's important is to remember who they are as a person. You know, at the end of the day, it is not about the illness. Illness is just part of them, but remembering who they are when they cannot remember themselves.
Yeah, and that's the most important thing, to maintain their dignity. You know, even though, and it becomes very challenging, because at this time you see them very confused, very sloppy, very, you know, not themselves, and then it's easy to just slide in and forget who they were. But I think to maintain the dignity of the person with dementia, it's very important to go back and remember who they were as human beings. Remind yourself of their personalities, and I think what you said, reminiscing, showing them old photographs, you know, talking about those incidences, those events, and that helps not only them but also you to remind yourself of who they were and maintain their dignity. Yes, yes.
So coming back to the theme, I think it's time to act on dementia.
Yes, it's time to act on dementia, and we would like to tell all of you all that Cooj runs these programs. We have a caregiver support program. We have a senior therapy where a lot of seniors, they come and they spend time 3 times a week with us from 9:30 to 12:30 on Monday, Wednesday, and Friday. And we're also starting off a COSME project where we will be going and assisting seniors in their homes. Of course, not with people with severe dementia, yeah, but generally people with mild dementia, with MCI. MCI is something called mild cognitive impairment, which is one stage before dementia, the stage of dementia sets in, and this is a large number of people have MCI. Yeah? A large number of people have just early stages of forgetfulness, mild cognitive issues, yeah, but not too severe to call it the stage of dementia. And all people with MCI do not progress to dementia. So we can actually work with people to build on their brain health and to support them psychosocially, and that will actually help to prevent a lot of the illnesses coming in, and not only dementia, but those with depression, with anxiety, with basic loneliness, as a preventive tool to someone developing more severe mental health issues. So on World Alzheimer's Day, I would like to reiterate to everyone to take this illness seriously. If you find anyone who has these signs and symptoms that we have just expressed, please seek help. Please take them to a professional for an assessment. There's nothing to lose, but at least we will know at what stage this person is, and we can get help much early on. So on behalf of Cooj, I would like to thank everyone. And I would like to thank Dale as well as Donna for sharing her story, and for Dale for all the inputs that you have given us. Thank you.